I've been a registered nurse for 5 years, and I've worked in an intensive care unit for 2.5. Our whole ICU has now been converted for COVID-positive patients. About 80% of those patients are on ventilators. We are now training med-surg, OR, PACU, and intermediate nurses to treat ICU patients. This is something that normally takes 6 months. I decontaminate myself before leaving work and again when I get to my front door. And I pray that I'm not an asymptomatic carrier that then infects one of my own patients. The stress for myself and my loved ones is unimaginable. My husband has willingly stayed at home to support me and taken on the risk of being infected himself. I have not seen or hugged my family or friends in weeks. We are told that we are short on masks, gloves, gowns, and eyewear goggles. We, like most hospitals in the nation, are reusing single-use items over the course of 13 hours or days or weeks. We're also now using homemade masks to wear over our N95s to keep them clean and so that we can hopefully use them for longer. We're trying the best that we can. We've never had such a high volume of critical care patients before. We're terrified of getting ill ourselves, but we continue to show up and work and fight this as long as we are physically capable. Stay home. Social distancing will only work if you practice 6+ feet away from each other and do not share objects that one or the other person has touched. If you purchase personal protective equipment, also known as PPE, please donate it to your local hospitals. We're in much closer contact for much longer periods of time with much higher concentrations of the virus, and we need our safety equipment to keep ourselves safe so that we can continue to come to work to care for you and your loved ones.